Immunotherapy has long been a hope in the treatment of cancer. I remember when I was in college, which was a while back, that was one of the things that drew me into oncology, actually, was the hope that we could somehow harness the immune response to get that to be a better anti-cancer therapy. And initially, most of that work was done with vaccines, which showed some promise in certain areas, but not much in lung cancer. But then in the last few years, we now have the checkpoint inhibitors. The first of those, the ipilimumab or CTLA-4, showed some activity in lung cancer, but was only looked at in combination with chemotherapy, and it was mixed. But then with the PD-1 and PD-L1 inhibitors, we've actually been seeing single agent response rates that range from 10 to 40–50%, mostly in the 20 to 30% range, depending on the trial and dosing and biomarker used. And given that most of our chemotherapeutic agents beyond first line only have response rates of around 10%, those numbers that we were seeing with the checkpoint inhibitors are quite promising. Where we are still struggling is with how to best select which patients to treat. So we don't have a great biomarker yet. There's PD-L1 testing, but unfortunately no consensus on what it means to be PD-L1 positive. Each company has its own assay, its own antibody, and its own threshold of calling positivity or not positivity. And we've seen responses across the board with these drugs in patients who had a negative biomarker based on the different assays. So there's still a lot that needs to be done to sort out what does it mean to be PD-L1 positive. And there are also a lot of questions about who are responding best despite that. So there are questions about whether the patients with a heavy smoking history are the better responders, whether there's hope of any responses with patients who have the more quote-unquote simple tumors, EGFR mutant lung cancer and whatnot. Probably there will be some role there. And then lots of questions around combination therapy. So there's promise, we're seeing single agent activity, but many questions still remain about how do we best utilize those drugs.